number. This is my
Well,
Google
that's
Voice
one way to make
number.
sure.
Yeah, it's a Google Voice number that's not, it's not acceptable in Canada, but there's a workaround. That's why it's a New Mexico area code.
Perfect. Good. Keeps the number private and you don't get crank calls and stuff.
Exactly.
Nice. Well, I appreciate you making the time to talk this morning.
No problem.
So the piece that I'm working on, it's sort of looking at like the pros and cons from a couple different area hospitals, because I cover the Hamilton and Niagara area,
Hmm.
about whether or not to keep or go ahead with their vaccine mandates. So Hamilton
Yeah.
Health Sciences just went ahead with it, but Niagara Health decided to defer theirs. And so I guess like I don't need you to comment like on those specifically
Right,
necessarily.
but in general.
Feel free if you're interested, but sort of generally,
Well, I mean,
you know.
here's the thing, right? So, what's at play here? What's at play here, obviously, is the need to keep patients infection free. And one of the best ways of doing that is to ensure that the people they come into contact with have a lesser chance of carrying viral load, and you do that by making sure they're vaccinated. On the other hand, we have a crisis in healthcare workers at the moment, particularly nurses, and nurses are more likely than, say, doctors to be unvaccinated, even though the vast majority are vaccinated. So, in some situations, in some institutions, I understand there's going to be some uh, infrastructural management pressures to maintain the healthcare worker capacity, even at the cost of increasing the risk of infection slightly. So that's going to be an institution by institution decision. I think it should be that way because this hospital will have this rate of vaccination, and this one will have another rate of vaccination, and that rate will determine whether or not they can function. Having said that, is there a way to accommodate those who aren't vaccinated? Well, um, testing is one possibility. We're in a crisis in Ontario with insufficient testing capacity. And I've been arguing that what testing capacity does exist should be reserved to get infected workers out of isolation. That does not mean using that testing capacity to accommodate the unvaccinated in their desire to remain unvaccinated, because testing is a scarce resource at the moment. If, on the other hand, we had sufficient testing capacity, if rapid tests were falling from the heavens, then for a short period of time, you could use rapid tests to control the possible infectious status of these workers coming in. But absent that capacity, it is troubling. So there is something also called working quarantine that's been in hospitals for some time. And working quarantine is when you're infected with something that usually requires isolation or quarantine, but we need you to come to work. So we'll slap a mask on you and put you in a corner and do work that is not a threat to other people. That's a possibility also, and I suspect some institutions are doing that. So if you test positive for COVID and you're not symptomatic, you're not spreading that much, then you can go work in the corner there and not deal with patients. I suspect a similar approach is being taken to the unvaccinated, with the assumption that they're more likely to carry viral load. The conversation is further complicated by Omicron and the ability of Omicron to compromise vaccine effectiveness against transmission. So let's back up for a second and ask ourselves, why do we care that healthcare workers are vaccinated? We care for two reasons. One is, if they're vaccinated, they're unlikely to get seriously sick, requiring hospitalization themselves. And healthcare workers are exposed to greater viral load, greater infectious doses, therefore are more likely, frankly, to be sick of that nature. So having them vaccinated protects them. But the other reason, and the one most people think about, is vaccination prevents infection and prevents transmission. That's been heavily compromised by Omicron. And the data is,
Mm-hmm.
still unclear, but it looks like whatever protection vaccination, 2 doses, was offering against Omicron is not negligible, but it's not as great as you might have hoped. That's why we're seeing so many breakthrough infections. 3 doses ratchets that back up again. I've seen estimates that the vaccine effectiveness against transmission for 3 doses is between 70 and 90%. And prior to Omicron, 2 doses gave you between 70 and 88%. So if you think about the vaccine stratagem as a 3-dose standard, then a 3-dose standard brings the conversation back to all healthcare workers should have 3 doses to prevent infection and transmission of others. But if it's not 3 doses, then a 2-dose conversation kind of takes the wind out of the mandate sails slightly. And it pains me to say that, but there's some accuracy there. There's also a messaging component. I mean, if healthcare workers aren't accepting vaccination, what does that say to vaccine hesitant people in the community? Healthcare workers are leaders right now, thought leaders, and I'm not one, so I can't say we, but they must step up and accept, the minuscule risk of vaccination to protect the community and to show leadership in that sense. So there's a lot going on here.
Yeah, it's a tough nut to crack, and like you said, it's I've heard a lot of people saying that yes, they think the mandates are good, they'll help keep people safe, but then as you bring up, once you start talking about the fact that even with 2 doses you could still be getting infected and it's not necessarily going to help there, then none of the hospitals at this point, at least that I know of, are talking about 3 doses.
Yeah, they really should be talking about 3 doses, I think. That should be the standard, especially for people at high risk for becoming exposed and people who will be working with other people. Because the point of 3 doses isn't to protect against hospitalization, because 2 doses does that well. The point of 3 doses is to protect against initial infection and transmission.
Right, and then I guess that would be what's protecting patients more than
Yes.
the 2 doses with the hospitalization.
Yes, yeah. And once you layer on top the mask wearing and the HEPA filters and the other precautions that we see in hospitals, and patients are okay. I mean, other arguments people will make is, well, with Omicron, you're going to get infected and you're going to get your additional immunity that way. Maybe we don't know. Um, but while you are pursuing that route, as I think some people are, you are a threat to others.
Yes, I did have one source I spoke to. They thought that because healthcare workers were perhaps more likely to get sick in earlier waves, that maybe they would already have some sort of immunity, and that meant vaccine mandates were less likely. What do you think about that idea?
Yeah,
less useful, I should say.
I mean that's interesting. It's a little confusing though, because the data is kind of all over the place when it comes to how much lasting immunity previous infection offers. Previous infection probably okay. There's one study that suggests that up to 30% of infected people never develop antibodies at all, which is concerning. But more importantly, Omicron is bypassing all kinds of immunity, whether it's immunity acquired via previous infection or immunity acquired via vaccination. So it's a non-discriminatory kind of reinfector at the moment. So that argument falls apart if you consider Omicron. With Omicron, really, it's a 3-dose conversation we're talking here, or a renewed modified vaccine, which is coming in a couple months.
Well, I don't think I have any more questions for you on this, but is there anything that we didn't talk about that you wanted to
add? Well, I mean, there is also the element of long COVID. It's unclear the extent to which vaccination diminishes the potential for long COVID, but there are strong arguments that it might. And if that's the case, then we want people to be vaccinated to reduce the long-term impact on the healthcare system, because a proportion of people who become infected will suffer long-term disability issues. And healthcare workers should be sensitive to that possibility.
Right, yeah, that's a good point. All right, well, thank you again for making the time to talk on short notice. I know you're always busy, so it's great that you're able to make the time. I appreciate that.
My pleasure. Thank you.